When dealing with Indigenous patients, it's important to recognise the past. Some Indigenous people may feel distrust, fear, or shame towards the healthcare system and hospital staff. Therefore, it's important to have a welcoming attitude towards your patients on initial contact.
Hi, I'm Joe. I'm your nurse for today. What's your name?
Hey Joe, I'm Nigel.
It is important when dealing with Indigenous people to build rapport with them before moving on to medical issues. This can be achieved by asking about their family, where they are from, and sharing information about yourself. Another thing to consider when dealing with patients from the opposite sex is to clarify with them if they would prefer to be treated or looked after by someone of the same sex.
Nice to meet you, Nigel. Is this your partner, Nigel?
Yes, this is my wife here.
I'm Judy.
Hi, Judy. Nice to meet you. So how are you guys going today?
Not too bad. What about you, Judy? You feeling good?
Are you comfortable right now as well?
I think so. I think we're pretty good. We only just got a chair for Judy, but she was a bit uncomfortable, but feeling better now.
Okay.
It is important to remember to speak in gentle tones, as high tones may be perceived as patronising towards them. Remember that English may not be their first language, and in some cases it may even be their third or fourth. Therefore, remember to speak slowly and clearly to these patients.
So has one of our members from Aboriginal and Torres Strait Islander team met with you today?
No, I don't think anyone's seen us. No.
Okay. Would you like to meet with them then?
I think that'd be good if you could. Are you able to organise that
Yeah,
for us?
definitely. So what I can do is I'll set up an appointment for you and one of the members will come to visit you shortly.
Oh, that'd be great. Thank you. That'd be great.
But it is important not to assume that all Indigenous patients have difficulty with the English language. If required, interpreters can be arranged through the hospital, including a representative from the hospital's Aboriginal and Torres Strait Islander team. When questioning an Indigenous or Torres Strait Islander patient, try to use a less direct questioning method. At times, direct questioning can be perceived as confronting and offensive. Communication is a two-way street. Volunteering information about yourself can make patients feel less vulnerable and less confronted.
So have you been to hospital before or is this your first time in hospital?
I was in hospital once before, a few years ago, I think. Yeah.
And how was that experience for you?
It was a bit worrying for us. We've never been to hospital before, and we've heard bad things about the place though.
Oh, okay, yeah, that's understandable. I had the same sort of situation. I went to hospital for surgery on my leg, and it was a very daunting experience. But over time, I did get to familiarise myself with the place, and everyone was very friendly.
Oh,
so
well, that's good to know.
I hope you have that similar experience here as well.
We're hoping so too.
Yeah.
Direct questioning for Indigenous Australians is useful for determining background information. However, when asking for personal information from these patients, it is important to avoid closed-ended questions. Open-ended questioning encourages Indigenous peoples to communicate more, as they prefer to speak more in a narrative format. Be aware that even if a patient is answering you with a yes response, it doesn't always mean yes to your questions, as they may not understand what you are asking or trying to quickly end the conversation.
So I'm just needing to take some observations from you today. Is that okay?
Yes.
Basically, you came in with chest pain today, so I need to get your baseline, so your standard heart rate and blood pressure levels and your respiratory rate to make sure that you've got normal measurements throughout your stay here in the hospital. So is that alright if I get some observations right now?
Yes, that'll be okay.
Great, thank you.
If the patient is looking around the room, it doesn't mean that they are not paying attention. It could mean that they are trying to avoid direct eye contact, as in Aboriginal culture, eye contact can be seen as a sign of disrespect, rudeness, or even aggression. Therefore, for nurses to maintain a professional attitude and maintain respect with the patient, try averting your gaze or lowering your eyes during conversation.
So this cuff will be a little tight around your arm while it's taking your blood pressure. Can you just let me know if you're feeling any discomfort as well?
Yes.
Contrary to Aboriginals, when dealing with Torres Strait Islander people, of the same gender, good eye contact is seen as a sign of interest and providing honest information. It is important to be an active listener in order to respect your patient and maintain trust. Make sure you wait for your turn to speak and not talk over your patients. In Indigenous culture, long silences and pauses are very much a part of the normal in communicating with each other, so do not presume that silence in a conversation is a lack of understanding.
So how would you say your chest pain is at the moment?
Yeah, it's there. It's not as bad as last time, but it still throbs a little bit. It's a bit more crushing now.
Okay. So how would you rate your pain on a scale of 0 to 10 then, with 0 being no pain to 10 being the worst pain?
5.
5.
It is important to make sure that patients understand the information that is being explained to them. This can include procedures that are being undertaken, diagnosis, and any medications that they may need to take. Simplify any medical terms used and avoid medical jargon so that patients don't get confused, and allow time for the information to be processed so that the patient can make an informed decision. If need be, explain the information to a family member, keeping in mind patient confidentiality.
Hi Nigel, so the doctors have reviewed your case and you don't have any problems with your heart. You're having a condition called stomach reflux, which is acid from your stomach going up towards your throat. It is a common condition as well. So the doctors have prescribed metoclopramide, and you just have to take your script to your chemist, and you have to take 1 tablet a day during breakfast. Yes. Does that make sense to you all?
Yeah.
Great.
To ensure this information is appropriately conveyed to your patients, use the hospital Aboriginal and Torres Strait Islander liaison services. It is vital for healthcare workers to use appropriate communication skills to ensure patients receive the best quality care, and to also preserve the relationship between Indigenous Australians and the overall healthcare system.